Hi, thanks for joining us today for our ABC15 virtual town hall with the latest on coronavirus as well as the vaccine here in Arizona. Again, I'm Melissa Blasius and I'm an investigative reporter here at ABC15. Joining me now is Garrett Archer, who is the ABC15 data guru who's been spending a lot of time poring over the coronavirus numbers. We also have Will Humble, the former state health director, who's with the Arizona Public Health Association now, and Dr. Aaron Carroll, board director of the American Academy of Family Physicians. Let's start with Garrett and talk about the numbers because they are astonishingly high. People are talking about Arizona having the worst COVID infection rate currently of anywhere in the world.
Yeah, so today, really, the statement that has to be made is that today is the worst day of the COVID-19 infection in Arizona. We have 7-day case average highs records in both, that's about 9,000, so it's a case average high for there. The death average is at 125, which is a record. Record number of deaths reported today, 297, my apologies, and then about 9,000 cases reported today. So all in all, very high numbers. Our hospitalizations, we had peak numbers in both inpatient and ICU COVID-19 numbers. And if you look at data from all across the country, it does appear that right now we have more people per capita in hospitals in Arizona than any other place in the country at this point. And as Melissa did suggest, we are still at the highest rate of growth in the world as of this moment. So right now, really high numbers in Arizona.
Yeah, and some of these hospitalization rates, you look at the number of COVID patients in inpatient care in Arizona, 4,920, COVID ICU, 1,101. The hospitals have talked about how extremely full that they are, that they don't have additional space. Some have stopped doing elective surgery procedures as a result of this. And Garrett, is there an end in sight? We're at the peak, so we don't know if we're going to keep going up or if we're going to round back down.
So that's exactly right. We can say that we're in a surge. We can say that we might be coming to a peak, but we don't have any indications right now in the data that the numbers will start to go down. So we really don't know. I would call this right now we're at a peak. I don't know if it's the summit. We could continue for a couple more weeks. We had a massive spike from Christmas, although the way that the numbers, if we just use Thanksgiving as a template, we should see much slower growth, if any growth, in the next several weeks, and then followed by a decline. So we could be coming out of at least case growth. Now, the problem with talking about coming out of case growth is that that still means we're still going to see very high death numbers, very high hospitalization numbers, even when we start seeing a declining case growth, because case is the leading indicator to what happens in the hospitalizations, to what happens in the deaths. So it's going to be at least another month of very high numbers in at least one of these important metrics.
Okay. Well, let's talk a little bit about vaccine here with Dr. Carroll. You were telling me that your practice can distribute the vaccine, right? And that now we are moving in Maricopa County from including not just the 1A people, the medical workers, but also including the 1B people who would be. Tell me who's in that category and how soon they might be able to get a vaccine.
So 1B, as determined here in the state, has included those seniors 75 years of age and older. And that's regardless of whether they have a concomitant health issue like diabetes or lung disease. If you're 75 and older, you are a phase 1B recipient. It also includes other frontline workers, such as police officers, anybody who would come into contact with public in their role as a frontline worker. So, and then recall that also we are still immunizing healthcare workers, not only for their first shots, but we're also catching up on their second vaccines. I received my first vaccine about 2.5 weeks ago. I'm scheduled for my second vaccine on Monday. So we're starting to see a ramp up in the number of people who are being vaccinated, and then phase 1B is going to be including a large number of people who are at higher risk. Phase 1B also includes people in group home settings, and so hopefully we'll start to outreach to those folks as well to get them immunized as quickly as we can.
And now the distribution is kind of needs some explanation, because from the side of people who want the immunization, first of all, if you're just a regular citizen, person over 75 who qualifies for this group 1B, you have to sign on with your county health department, right? You have to go to their website in order to get a slot, right?
So here's the challenge on that, right? So I have a lot of patients over the age of 75. Many of them do not own smartphones. Many of them do not have access to a computer, and especially those in group home settings have to share one computer with the people who might be running that facility. So distributing vaccines to folks who are over the age of 75 and expecting them to enroll in a statewide computer setup is just it's a recipe for disaster, because you're not going to get enough of them enrolled. And so, yeah, this centralization of the distribution of vaccines doesn't take into account that many of these folks have technological barriers to getting enrolled and to getting the vaccine.
So it sounds like, and I don't know if there's any groups at this point that are making that effort to help seniors sign up. Are you aware of any?
Other than what I try to do is enlist family members who might be able to outreach to them. So at my practice, I've already identified 1,100 patients over the age of 75. We know many of their family members because I'm a family doctor. So I'm taking care of their sons and their grandchildren. And so I'm enlisting them to get them out to their homes. And whether or not I can get the vaccine in my office, which would be the most ideal situation, is to be able to deliver it from my office. Regardless of that, if the requirement is for them to go on the AZDHS website, Arizona Department of Health website, to enroll, I'm directing the children and grandchildren to helping their grandparents to get them enrolled so that they can get the vaccine as soon as phase 1B opens up, which I believe is on Monday.
Okay, and we should, one of our viewers here on Facebook mentioned that 1B also includes educators. So
yeah, that's absolutely right, and that's extremely important. It's so important we get our educators vaccinated as quickly as we can.
Absolutely. Now, so as this vaccine process goes along, we still have to deal with the existing surge in cases. So Will Humble, let me ask you, what is your advice to people as far as a public health standpoint right now when we're looking at these numbers averaging 9,000 plus cases a day? I mean, that's like this week, 1 in every 110 or 115 Arizonans are going to have coronavirus and test positive for it.
Yeah. So of course, my biggest concern is that, you see that number, 9,000 cases a day. And when I look at that number, what I see is that number translating into the number of new admissions to hospitals that'll be needed in the next, say, 6, 7, 8, 9 days. It takes about a week for somebody to get sick enough to need to be hospitalized on average once they've been diagnosed with COVID-19. And so when you see these 9,000 case days, that means, upwards, like 700-800 people per day coming into the system. And, thankfully, Garrett does a nice job every day of putting in there the discharges from the hospital. And so that's really what we're talking about, is there's an influx every day of new cases, new people that are sick enough to need oxygen and other therapies, and then balanced out with how quickly people are discharged from the hospital. And it continues to erode capacity, and it's causing hospitals to change their practices, their admission criteria, their discharge criteria, the resources that they have, the shared spaces, there's, the staffing ratios. There's just, so basically my advice to people in Arizona is stay out of the line of fire right now. It's not like September or October or even early November in our hospital systems. It's totally different. And you do not want to get this virus and end up being sick enough to need to be hospitalized, because it's not going to be the same type of hospitalization that you would have experienced back in September or October.
Mm-hmm. Let me mention one of our comments from Jacob Rudder, which here's a thought: masks, social distance, keep travel to a minimum. Maybe. Well, that has been the advice all along, and yet here we are at this crisis level of cases. So are people just not following it? I mean, we saw the video from the governor's own son at a crowded dance party recently on social media. Do people just not, it goes in one ear and they have good intentions, and then they get invited to go somewhere and they say, I'll be okay this time?
Yeah, can I tackle that one?
Yeah, sure.
Hey, look, there is a subset of people in Arizona and across the whole country that have been doing the right thing from the very beginning and are still doing the right thing with infection control and trying to stay out of the chain of transmission of this virus. But there's other people, and there's other people who are a lost cause who say, I'm never going to wear a mask and I don't care about this stuff. To me, they're a lost cause. It's the people in the middle that need to have a policy intervention in place to drive them to have the right kind of behavior. And that's why, so many chief medical officers of the hospital systems and other advocates in the public health community, including myself, several weeks ago, sent a letter to the governor urging him to put in place some mitigation measures, some policy interventions to drive human behavior in the right direction. Because in the absence of that kind of policy change, the people in the middle that aren't, they're willing to do the right thing if you force them, if the policies don't invite them to do the wrong thing, and we still have policies in place that are inviting people to not do things right. And by that, I mean that we have bars that are open across the whole state that, while they have been required supposedly to follow mitigation measures since the end of the pause, which is early August, there's never been any enforcement of those mitigation measures. 15 enforcement actions over tens of thousands of businesses over the last 4 months. That's not enforcement. And so the businesses have devolved their practices such that there really isn't many of them. Some are still doing the right thing, but enough of them are letting customers do whatever they want inside the bars, restaurants, and nightclubs. And that's enough to build the kind of virus load that led to the explosion that resulted from the post-Thanksgiving and then Christmas and now the coming surge because of New Year's. That's my opinion. Policy needs to drive the right kind of behavior change, and it's not in Arizona, and it's the governor and Director Chris Fall.
Is there a new push again from the health community, from the hospitals, from the doctors, from other people in healthcare, saying that we again a push to close the state in some way, or to have a lockdown, or to close all the restaurants, or is there any active push at this point for the governor to take some other action?
Well, the biggest letter came from the chief medical officers a few weeks ago. There's many of us on Twitter, Dr. Carroll's one of them, who have been urging some policy changes from the governor and the health director. I simply don't think that they are interested in any kind of additional mitigation at this point. I mean, in my opinion, is they're trying to vaccinate their way out of this, which eventually will work, but not until a lot of additional people die unnecessarily, because, we didn't have the right kind of policy interventions when it really mattered, which was right before Thanksgiving. They declined to put those kind of, interventions in place, either meaningful enforcement of the mitigation measures, which has never happened, or additional mitigation measures like what we did in July, which worked. If you remember what happened in July, closing the bars and having restaurants go back to takeout service dropped viral transmission by 80% in Arizona.
Okay. Let's talk a little bit more about the situation that's going on in the hospitals, because we touched on it briefly, but the latest numbers from the Arizona Department of Health Services showed that yesterday the ERs took in another 2,280 people with COVID or suspected COVID. So there continues to be this march of people coming in the doors every day, a couple thousand people right now, who are looking for or needing care. how long can our hospital system hold up under these conditions, and what efforts are being done to create overflow facilities, the kinds of things we talked about early in the pandemic, such as St. Luke's Hospital, the old St. Luke's Hospital, even putting something up at the Arizona State Fairgrounds, those kinds of ideas.
Dr. Carroll, that's a good one for you.
Sure. So my, if you recall, there was an executive order by our governor who, directed some of the CARES funds towards hospitals to improve the staffing in those locations. The challenge here is that, if you go back to May, that May timeframe when we first had our first surge, we were the worst in the world in terms of per capita cases. And so we were able to recruit, locum tenens nurses, nurses who were, traveling nurses, and bring them to our state to help staff the ICU and the emergency rooms and whatnot. Now, we had a lull, right, going into August, September, October. Those nurses then went to other states. And if you recall, North Dakota, South Dakota, Midwest, Iowa, all got hit really hard during those months, and have kept a high census since that time. So those traveling nurses, those locum nurses, are now in those states, and have also migrated to New York and California, which are getting hit really hard. And now they are fixed in their locations. And now just 2 weeks ago, Ducey says, okay, here's some more money to the hospitals to hire more people. Those people aren't available anymore. They are working hard in these other locations. So our only solutions can be, or should be, is to enlist, ideally, some of the National Guard and Army Reserves. My Army Reservist, I have an Army Reservist who works for me. She's a physician assistant. She was deployed to Texas for a while over the summer to help them there. We need that kind of almost federal level deployment. Get the big tents in the Arizona State Fairgrounds, reopen St. Luke's, get those bodies in there so that we can, and those folks aren't going to be your high-level ICU patients. Those are going to be the middle ground, just need oxygen and a close monitoring, but just not safe enough to be home. Those folks can be in those hospitals with kind of that med-surg level care. But the ICU level care, the intensive care, which requires intubation and ECMOs, are all going to have to be in our fixed hospitals with the high level, highly trained staff that are already there. Let me, if you don't mind, I want to share one anecdote. I was covering the surge shifts just a couple weeks, 3 weeks ago, and then I'm going to be going back in again in about 2 weeks for another 3 shifts. We coded a patient who had COVID. They stopped breathing, their heart stopped pumping. I came while they're doing compressions and intubating the patient. The patient was on the far side of the room because there was another patient in the same room with COVID, fully conscious, fully alive, listening to the person next to them dying. Now, if that doesn't wake people up, that you have 2 patients in the same room with COVID, which is the only way we can fit all of these patients with COVID in our hospitals, listening to the guy next door to them dying of the same disease they have, that needs to be the story that gets out. I wish we had cameras. I wish we could show the look on that other person's face while they're listening to the other person dying. Thankfully, we saved that person. They ended up dying a day and a half later. That's what's happening everywhere in our state. Please wake up today. And we need our governor to do something today to mitigate what's going on, because just continuing to stuff the doors is not a policy. It's a cop-out.
Well, and the governor has said when we last talked with him specifically about closing the state and the calls to close the state in early December, his response was that he is trying to find a balance and didn't want to put many people out of work right before Christmas. That the economic hit that the state does take if we close bars and restaurants and places that people go in a state so heavily.
So I'll comment to that. I mean, and Will has said this several times, that targeted closures and targeted mitigation efforts will help to reduce the spread, but also help to maintain the businesses and allow them to remain alive after all of this. We're talking about the health of our business economy as well as the health of our public health and the patients we're charged with taking care of. Recent evidence suggests that the states who have implemented statewide mask mandates financially do better than states that have not. And the reason is because there is a unified standard application of a mitigation effort at the business level that the business can then enforce, that also allows them to remain in business and then reduce disability, debility, and death, which maintains customer flow. So there's some early evidence on that, and I would encourage anybody, especially our governor, to investigate that in terms of what changes it can make at the government level that would maintain a financial viability as well as health viability.
Okay, thank you for that. Garrett,
I was going to add to what Dr. Carroll was saying. It's important to note too is that we are, when it comes to hospitalizations, as far as what the data looks like, we are about at the time when people who were infected at the Christmas holiday are going to start showing up at the hospitals. And that also means that there is a possibility that we see yet an additional 30 to 40% bump in these hospitalization numbers in the next couple of days. So over time, and as Dr. Carroll was talking about this hospital system being stressed, we until we see some mitigation in these numbers and we start seeing that peak starting to go down, again, there's no sign that these hospitalization numbers are going to be deterred, and they will just be providing further and further stress onto the system.
Melissa, can I jump in? I just want to do really quick to add on what Dr. Carroll and Garrett just said. Look, I'm sensitive to what the governor had said about wanting to make sure that there was a safety net if you do targeted interventions like where we are now. I mean, if we had done better job enforcing the mitigation measures on bars, restaurants, and nightclubs, we may have been able to probably would have been able to prevent what's happening right now. Still have cases, but not the crisis. But we're at a point now where, if we don't shut the bars and have the restaurants go to takeout service, this is going to continue into February. And I'm sensitive to the comment that he had about the safety net. But guess what? Congress, number one, he backfilled the state's general fund to the tune of $400 million of CARES Act money that could have been used to create a safety net. There is still CARES Act money from the first go-round that's available to create that safety net. Congress just passed a new it's not called the CARES Act, but enhanced unemployment insurance to an additional $300 a week for, say, bartenders and so forth. So, if you're going to decide not to use your CARES Act money to not create a safety net and then use that as the very excuse not to use intervention measures, I mean, that's a self-fulfilling prophecy. I just think it's a hollow argument. And I felt compelled to call it out.
Well, thanks. Let's move. I want to get to talking about schools a little bit because there's a lot of discussion about whether schools should be in session or out of session and how severely COVID affects children. So let's talk a little bit about that. Some of the school districts who had planned to open in person this week have decided that they're going to do 2 weeks as virtual school before trying to go back to in-person school. Will things be safer in 2 weeks? Will?
That was to me. Well, I don't think so. Quite honestly, what Garrett just said is compelling, and he's right that's what the data are showing, that this increase in new cases from infections that happened over Christmas is going to translate into new hospitalizations in the next few days, and then another increase in hospitalizations from infections that happened over New Year's. I don't see how, given the fact that we still have no meaningful interventions in places that really amplify this virus, I don't see how things are going to get better in the next 2 weeks. I mean, Garrett, don't you agree?
No, I don't think we're going to see a peak in the next few weeks, at least simply because if you think about it, as we talked about the virus timeline, it's January 7th. People who would have been infected on January 1st would probably be showing symptoms either close to now or just the last couple days, which means they're just getting tested now. We may not even have it in the system yet. So we're not seeing it quite yet. We're still in that window, as I said. And then we have a further 10 days or so for the hospitalizations to kick in from the increase in hospitalizations to kick in from any increases on January 1st. So this, as you said, Will, we're not at a peak yet. It's going to be at least 3 weeks before we start seeing a downturn, if that does happen.
Okay. And Dr. Carroll, let me ask you this. As a family physician, have you seen children with severe cases of COVID, or are they mostly mild or asymptomatic?
No, children handle the illness better, right? They're younger, they got better immune systems, better overall health in general. Most of them are pretty active, physically active. So when they get sick, even though it does knock them down quite a bit, they tend to recover better. However, that doesn't mean that the long-term effects of COVID, what we're calling now long COVID, won't hit them. We've seen cases of, I've seen a few of my kids, not my kids, my patients who are kids, with headaches that last 2, 3, 4 months. I've had probably about 1 or 2 now who have severe confusion. That I've actually, a couple college students, I've had to give them medical leave from school because they can't focus. Their minds are jumbled, and they're having a lot of trouble concentrating and getting through school. So yes, the illness is acute. The illness is typically fairly short, 1 to 2 weeks. They tend to not have as bad a respiratory issue, but that does not mean that it is benign. And seeing kids with long-term health issues, and again, we don't really know how long these will go on, has me concerned of the cavalier attitude that a lot of kids and parents are taking towards this illness.
Have we seen, Will, based on what you understand from your network that you work with and your association, have we seen schools that have had significant outbreaks of COVID amongst the students, or where they believe that it's the school itself in which the virus is spreading?
Yeah, no, you're bringing up a really interesting point. And when I advise, superintendents and board members who just email me and so forth, what I tell them about schools is it's not just the community metrics to look at. That's one factor to look at as you're making a decision about in-person instruction. The other thing to look at is how successful you were last semester with mitigating the spread, a cascade of virus within your school. And so if you are a school who did a good job you're going to have cases. Every school is going to have cases. The question is, how do you handle those cases, and do you have mitigation measures in place to prevent cascades of new cases? And I've heard from schools that have really done a good job with that contact tracing and the mitigation measures, others that have been less successful. The main theme that I've heard, and this comes from contact tracers at the county health departments as well as school districts, is that they've been a lot more successful at mitigation in K through 8 than they have been in the high schools. And it has been the high schools that have seen really more spread of the virus than the K-8. I think that's attributable to a couple of different things. Number one, as Dr. Carroll mentioned, the literature does show that younger kids do better, just more likely to be asymptomatic for one thing and never be identified as a case. And have better outcomes. But also it seems to be easier to get K through 8 kids to follow directions and keep their mask on and so forth. It's counterintuitive, isn't it? I mean, you would think the older kids would be the ones that would understand what they need to do, but they're also old enough to know that they could cheat, put their mask below their nose, look around when the teacher's not looking and take their mask off. And so really 9 through 12 has been where the spread has been. And so one of the things I've been mentioning is it might make more sense that when we do open up schools later in January, let's say if things get better, or early February, to consider opening up K-8 before 9 through 12 for 2 reasons. Number one, the spread factor, but number 2, the fact that kids in 9 through 12 are better able to learn from remote learning because of their cognitive abilities and so forth. So when I talked to the superintendent a few days ago, that's one of the things that we talked about.
Can I follow up on that?
Yeah, sure thing.
So I've looked and I've thought about that whole issue with the K to 6 and 7 to 12. K to 6 stay in one classroom. They don't tend to get up or mingle. They don't tend to discuss. They're usually just in one place for a prolonged period of time. And like you said, they're more likely to follow instruction, keep their masks on. There isn't as much air disturbance in the room. I think that there probably could be better direction of air away from the educator towards the children so that there isn't that passage. Whereas the kids are in older grades, move from classroom to classroom, mix air, take their masks down, talk to one another, share lunches, and then play sports. And so they're pretty close when they're doing that as well. So I think that the part of the reason that we don't see spread in the younger groups is because of the logistics of how they are educated, as opposed to the older kids. I've suggested that what would be better is to have groups of kids go together from room to room and allow the educator to stay in one place, or have the educator move room to room. So that the kids, like let's say 10th graders all sit in one classroom, and the math teacher comes in, teaches math, leaves, and then the English teacher comes in and teaches to the same classroom that never moves, because that would lead to less air disturbance, which is how this thing spreads.
Okay. Interesting concept, especially about the young kids versus the high school kids. We've been receiving a lot of really interesting comments here. I'm going to go back a little bit because we've been talking about schools. To Julie Harrington, who put a comment in at 1228 and saying, to close down small businesses and leave big box stores open speaks volumes. And she's talking a little bit about how it's about profit and not health concerns. And that was kind of interesting to me because we've heard this a lot, that small businesses, they believe, have been impacted worse than the big box stores, and that they don't understand why some businesses, especially the big corporations, are allowed to remain open and when smaller businesses are closing. Do you want to address that? And what's the threat of spread if you're in Home Depot or the grocery store?
Well, let me start by just saying, in our state, all those businesses are open. There's hardly restrictions at all. I mean, restaurants and bars are supposed to follow mitigation measures, but there's no enforcement. So at that level, at least in our state right now, I don't see that there's really a difference. One of the things we do know is that the places that amplify this virus are enclosed indoor environments where people stay a long time without masks. And so what is that? Okay, it's bars for sure, because especially nightclubs, that's the worst. Because you show up, you might stay 4 hours, not have a mask. It's an indoor environment. Alcohol's involved, loud music, you're talking loud, lots of particles. Regular bars, same thing. Restaurants also, you're there for 3.5 hours with no masks sometimes just 2 hours. Most of the time alcohol's involved. So people would start talking loudly, poor ventilation. Now, juxtapose that with a hardware store or let's say a big hardware store or a large box store. What happens in that environment? Part of the business model doesn't include taking off your mask. So it's bad compliance in a lot of places, but at least people are generally wearing masks. They're only there to get their stuff. So I think the average transit time might be only 45 minutes or less when compared to at a bar or restaurant, it's a much longer period. They tend to have higher ceilings. So there's better ventilation. Dr. Carroll, you may want to jump in on that too. But to me, it has to do with small, closed environments with poor ventilation, with long stay times, people without masks, where there's alcohol involved.
No, I'd agree with that. I'm a small business owner, so I have the challenges of owning a small business, and we put in a lot of mitigation efforts back in March to keep our patients and our staff safe. To date, none of our patients have ever gotten sick from an exposure at our business, and neither have any of our employees. I feel safer going to a small business. I think that that personal level of touch has them kind of on tenterhooks to make sure that everybody is following the rules. And then just this seems like they're doing a better job, in my opinion. Now, the high ceilings, the ability to separate, the ability to stay 6 feet apart from one another in Home Depot, that all helps. And ideally, everyone's wearing their mask. Not always, but ideally they are. I'll tell you though that I visited like a Target recently. Folks were wearing their mask below their nose. That doesn't work. I'm sorry, it's not called a chin mask. It's called a face mask. But in general, when you go into a store and you look up and you see ventilation high up, at high ceilings, you're probably going to be a little bit safer in that store. It doesn't give you an excuse to not wear your mask and make sure that you're staying away from folks.
Okay. Dr. Kara Chris, the current state health director, has been pretty adamant about one point, and that's about gatherings, small gatherings in people's homes or medium-sized gatherings in people's homes, parties for the holidays, and has talked about the risk of spread there. Is that a great concern? And let me ask Dr. Carroll, are you seeing this with your patients that a large percentage of them are being able to trace their virus and getting the virus, contracting the virus from a home gathering versus some larger establishment?
After Christmas, I remember 4 days after Christmas, an 82-year-old patient of mine called for COVID-like symptoms. We were able to test her. We have an in-house PCR test that we do in 20 minutes. And she was positive 4 days after Christmas, and that was her only exposure. She knew that that's where she was exposed because that's the only time her bubble was penetrated. And that happened at Thanksgiving. It happened at Christmas. It's going to happen again at New Year's. We're already seeing a lot of folks who have New Year's exposures. There's a reason we emphasize the bubble. Our bubble, my home bubble, is my wife and my two boys. We do not want that bubble penetrated. And with the case load of 10,000 new cases today, with a 33% positivity of cases against tests today, that means that 1 out of every 3 patients who is being tested has the disease. Having that Venn diagram of bubbles is getting bigger and bigger in the middle, and it's just not an ideal situation for our healthcare system here in Arizona.
So kind of this discussion about people had their circles with their safe neighbor friend or their safe sister and their family. Is that getting to the point where people should even not see anybody outside of their house?
I've already had cases of people. My neighbor down the street, 3 doors down, who I normally hang out with, got me sick because he didn't tell me that their grandson came over for Christmas, and that's where they got sick. And so, we're at that point. We're at a really high caseload point. Now, the counter argument to that is mental health, right? We are, as humans, we're social creatures. We need that touch. We need that connection with other humans, and it's very, very difficult, and especially for our senior population, especially the widow and widower population who had that tight circle either in their assisted living facility or nearby where I am is Sun Lakes. There's lots of folks there who live alone in their home and depend on that community, the pickleball community, the bridge community to be their social circle for their own mental health. And we're running into a lot of folks who are starting to have pretty severe depression from that. So it's difficult. It's hard to tell people you need to stay away from other folks. We need to come up with new ways to reach out and to connect. And this is our chance to do that and to come up with those methods of making sure that people know that we're out there for them. We're here for them. We want to connect with them. But right now, in order to keep them safe, keep them healthy, we can't hug them and we really can't shake hands.
Okay. So I've seen a couple of comments about this, about the survival rate of COVID, saying that 99% or so survive. Garrett, I know you've got some numbers on deaths and death rates, and people say, well, it's like a bad flu and 99% of people survive. Do you have those numbers there about how many Arizonans have died? It's almost about 9,500 at this point.
Yes. So I wish I had those numbers with me completely, but I do have some numbers. 9,741 deaths have happened so far. If we look at, for example, I'm going to share my screen really quick. This is a typical screen when we do our normal data broadcast daily. We go to this page. This is the ACHS page. We can show you the demographics of what is occurring out there. You can see the vast majority of deaths are coming from the 65 plus category, 7,200, followed by the 55 to 64-year-old, which is 1,424. 45-54 has been 620, 20 to 44-year-olds, 469, and then under 20 has been 17 of that 9,741. So obviously, the older you get, the chances that if you contract this, especially if you go to the hospital, if you are someone who's over a certain age and also go to the hospital, your chances do go down quite significantly, unfortunately. And that's sort of what we're seeing. We're seeing, if you look at Maricopa County's data, for example, about 84% of deaths occur from either people who are over the age of 65 and have one, or have one comorbidity. That's the high risk group that are being impacted by far in this pandemic.
So again, it's those over 65 age bracket that's really the most at risk for death. But even people, middle-aged people, what's the death rate there? I don't know if either of you have calculated, Will or Dr. Carroll, recently. Isn't it something, 1 out of every 1,000 or 2,000? I guess it's whether or not you want to take the risk, right?
Well, let's think about this. Congressman-elect Letlow died from COVID. He was 41, I think?
He was 41.
Yeah, 41 years old. And as far as I know, didn't have any other health issues. Young man, healthy, and died. And part of the issue here is, okay, so let's just say 1 out of every 100 people die in general. That's the number. I think it's probably closer to 1.5 to 2%.
It's 1.7% case.
Yeah, I think it's going to be closer to 2% when it all boils down.
Sure.
We don't know who that is. We can't say, yes, you have a higher risk of dying if you're over the age of 65, but that doesn't mean that if you're 41, you're not going to die. That doesn't mean that we should exclude that group under 35 that has had, 700 deaths, I think? It's a pretty significant number of young people who have died. When I was in the hospital this summer, we had a 21-year-old die. 21 died. You cannot just say, 1 out of every 100, that's fine. It could be your grandfather. It could be your dad. It could be your daughter. If it becomes that close to you, then 1 out of 100 is a big, big number. And that's what we're dealing with. We're dealing with mothers and daughters, grandfathers and grandsons. Those are the folks that are dying. And let's not let it be one of the people that you know, because that's what we're trying to avoid. It is a preventable illness. Let's get this straight. It is a preventable illness. With a vaccine, it will be a immunologically preventable illness. But to accept it and say, we're all going to get this, that's just not acceptable. It's not acceptable to me. It's not acceptable to most of us.
Okay. Let me just take one more comment from a viewer, William Peters, WM Peters. To reach the 80 to 90% immunity required from the vaccine, we would have to vaccinate kids. Nobody's talking about that. So let's talk about vaccinating kids, right? Currently, the vaccines are not approved for children.
I'm all on board with vaccinating kids. And as a matter of fact, that would help to reduce the spread pretty significantly, because we know a lot of kids can be asymptomatic carriers. The reason we are not vaccinating kids today is because the clinical studies have not included children as part of those study groups. However, now that the vaccine's been distributed, they are doing studies on the younger age groups with vaccinations. And I believe they're probably going to pursue it more with the traditional vaccines over the mRNA vaccines, only because the mRNA vaccines are very, very new. It'll be easier to get the FDA approval for a vaccine developed under the traditional method as opposed to the mRNA method. But whatever it takes, yes, we should be vaccinating kids, but we want to make sure that it's safe for them, which is why they're continuing clinical trials on those.
Okay. Well, one other question, because we haven't touched on this in many of our discussions we've had, is about churches, right? We actually are receiving at ABC15 tips from people who are upset, calling out churches for having large gatherings. Are we seeing spread in churches? Are you safe to go to church on Sunday with a mask for an hour? Or are there thoughts on that public health wise? Maybe, Will, that's a better question for you.
Yeah, so it depends on the mitigation measures that they're using. So my parents are 85, and for a long time they haven't been going to church. They haven't for the last few Sundays. I've been helping their church with their mitigation measures, and they have good ones in place. They're doing distancing, they're doing symptom checks, they're requiring masks, they reinforce masks when they fall behind the nose. They got rid of the
We
coffee.
might
I
have lost.
told them that. Sorry about that. For my parents, I said,
It looks
Well, we
like
might be losing Will. Dr.
the
Carroll, did
benefits
you have
outweigh the risks because they had such good mitigation.
Okay, so Will, you've looked at the mitigation measures, I believe, for your parents' church is what you were saying, and because they have good mitigation measures, you think that is okay. Dr. Carroll, any other thoughts to piggyback on that? Because Will's audio's cut out a little bit.
Yep. So I haven't attended church. I'm sure I'm going to have to go to confession after all of this. But we watch our church on television. I've recommended to my parents not to go. They go, but they've reassured me that they've done social distancing and they require masks, and kind of they've assigned folks to go to certain masses. So there weren't too many people at the same church at the same time. I have had cases come from churches. I've had one woman diagnosed this summer who got sick while she attended church services in Prescott. So it does happen, and I think that if you're going to flaunt the public health guidelines that are out there, which is wear a mask, socially distance, don't get in crowded areas, and make sure you're checking your ventilation, then you're going to get sick. And unfortunately, a lot of folks who attend mass and church services, synagogue, and are going to be older folks, and those are folks going to be most susceptible to having a bad outcome from this illness.
Okay. I'll let Garrett here. Do you want to send us off with one last look at the numbers and what you are expecting to see in the next few days?
Sure. So again, with our, let me see which the best one to look at here. So let me show you where we are right now. I'll go with cases and deaths, of course, because those are the two most important to look at. This is what we look at right now when we look at the case epi curve. This is the date of collection of the positive tests. You can see this is what everyone's been talking about. This is the spike, the Christmas spike, that will continue because we are still getting positives into the system from that whole week from Christmas to New Year. So this is essentially what we're looking at is this going to continue on an upward trajectory, or will this start to taper off and then obviously continue and begin to go down? Now that we're coming out of the flu season and we're coming out of holiday season, it stands to reason that this is going to start going down, but we don't know how many more weeks of these over 10,000 case numbers. And then when we look at deaths, we have basically the same type of situation. We see a lot of deaths being added right now, and they're all being added from basically the time around Christmas. Now, the important thing to remember about these deaths are from Thanksgiving. They're not from these deaths are from infections that happened around Thanksgiving. So now we have to wait at least another 2 to 3 weeks to see what the consequences of Christmas are before, even if those case numbers go down. This is what I'm talking about. This graph is not going to go down for at least another 15 days until after the case graphs go down.
Okay. Well,
I will. What I was going to say, I'll give you one last thing because everyone always asks for it. Let me go to my last numbers here. Now, we can't give recovery numbers out because, as Dr. Carroll would probably mention, or would agree with me, there's no way to actually define what a recovery is. But what I can tell you is, as far as the number of active or inactive cases in Arizona, cases that are under 14 days old, about 85,000 cases that are going on right now are under 14 days old, so they're the most infectious. Dr. Carroll, please correct me if I'm ever wrong about this. And then there are 179,000 cases in Arizona right now that are under 27 days. And essentially above that line, it's pretty unlikely that anything above that line is infectious at that point. So that's really what we're looking at with what's active out there in the community right now.
I think it's safe to define an endpoint at 28 days, and if they are not hospitalized by that time, then they are no longer a case. Because if you're going to be sick still at 21 to 28 days, you're probably going to be a hospitalized patient. And one thing that I want to point out on as you speak here, Garrett, is that there is a little bit of a what I would call a margin effect, right? There are only so many cases that you can admit to a hospital, and as the hospitals load up, they're going to be sending more and more patients home that would otherwise be hospitalized, but because of hospital load, they are being sent home because they aren't as acute as maybe the bed that's right next to them. And so we're going to see a curve go up, and there's going to be a margin effect on that curve. It won't spike as much as we get later on in the case number count because there's a capacity issue that marginalizes it. And so I want folks to understand that it may look like a summit, but really what it is more of a margin that hospital capacity has been reached.
Okay. Thank you, Dr. Aaron Carroll, Garrett Archer, our data guru, and also thanks to Will Humble, who obviously had some internet issues, which we experience from time to time, who is the former state health director. We appreciate you joining us and answering some questions and kind of guiding us through this crisis time with the COVID-19 pandemic. Thank you very much, and have a great day, everybody. Stay safe.